chest is hurting. My arm is going numb. Feel a little weak and tired, dizzy. What you know what to do if one of your co-workers is displaying these signs? Hello, my name is Ken Howell. Today I'm going to inform you some basic life-saving skills that you can use in first aid in combat and non-combat related situations. You're asking yourself, why do I need to know these? Because at one time in your life you can become a first responder, and you can make a difference between life and death by knowing these basic steps. Hopefully today you can learn the basic life-saving steps that enable you to provide medical training until medical personnel arrive on the scene. By knowing scene management, the signs and symptoms of shock, ways and types to control bleeding, how to splint a fracture, and transport personnel to a hospital if needed. Scene management. Why do you need to know scene management? You never want to make yourself a patient, so always have to look at the scene. That coworker that's laying down on the room floor, was he there because he had a heart attack? Was he there because it was electrical and he shocked himself? Was he there because it was a chemical? Car accident. You never want to roll up on a car accident and the car be leaking gas and then you run up there and the car explodes. You always need to check the scene before you enter. In combat, the best medicine is to continue firing before you put down your weapon. You always want to fire until you hear cease fire before you grab your co-worker and drag them back and perform first aid care. In non-combat, you want to make sure there's no hazards. You don't want to make yourself a patient before you can even get on somebody else. Once you've cleared the scene, you want to assess your patient. There's a number of patients and you're not going to be able to treat everybody. So those with minor bumps and bruises, they can work on themselves or somebody else take them. You need to perform triage and rate them: severe, non-severe, and critical. Those that you can help, help. Some of the people you're not going to be able to save them. Just pray for them and go on. Once you know the patient assessment and who you're going to treat, the first thing you need to do is treat for shock. You always want to talk to them, keep them calm, keep them comfortable, keep them warm. The best thing is to keep talking to them. I always want to use the Black Hawk Down movie where the guy's laying on a stretcher and they keep telling him everything is going to be okay, everything is going to be okay, even when it's not going to be. Keep them calm, keep them talking. Some signs of shock: they're going to have nausea, they can be throwing up, they can have slurred speech, pinpoint pupils, sweating. The one thing you don't want to do is give them any food or anything to drink. Now that we've checked the scene and we've made sure it was safe, we assessed the number of patients that we can treat, and we know the basis for treating the signs and symptoms of shock. The first patient you need to treat is yourself. There's a lot of diseases out there, communicable diseases, that can be transported from one person to another through blood, through saliva. You always want to protect yourself. You want to get the protective mask or the protective barrier when you're performing CPR, or you want to have the latex gloves. The common diseases such as hepatitis, HIV, tuberculosis are all spreadable. You want to make sure you take care of yourself first, and like again, you don't want to become a patient later on. Once you know who you're going to treat, once you're protected yourself, you want to perform your ABCs of first aid. You want to check for airway, make sure it's not a clogged airway. B, breathing. You want to make sure the breathing, make sure the chest is rising and lowering adequately. And C, you want to make sure there's circulation. Touch their end of their fingernails. It should go white and then turn back to pink. Same with their toes. You always want to check your ABCs, and then you can perform CPR if needed. I'm not going to cover CPR. If you want to take CPR, American Red Cross and American Heart Association offer these two. I highly recommend you take them. But with taking the American Red Cross, they've added a D and E to the alphabet of primary assessments. D is disability. You're always going to check for a head and neck injury. And E is environment. You're going to want to get them out of a hot environment. If it's 200 degrees, get them under the shade. If it's negative 20 degrees, get them somewhere warm. If they fell in a lake, you want to get them out of their wet clothes. This ain't time to be bashful. I know some say, hey, I don't want to take off a female's clothes, but sometimes you have to do what you have to do to save a life. Once you've assessed the patient, you're going to look for internal and external bleeding. External, kind of obvious, you'll see the blood. But internal, you're going to look at their chest and abdomen. It may look swollen, may look bulged, may have a bruising color to it. Same with their arms and legs. Everybody's had the internal sprained ankle where their ankle swells up like a softball. That's all internal. External, you're going to see the bleeding. There's three types: arterial, venous, and capillary. One oozes, one just flows, and one just spurts. That really doesn't matter, but what you need to know are the 5 ways to control bleeding. And the first and foremost is the one that everybody does when they cut themselves shaving. They hold the fingers there to their face and count to 5. That is direct pressure. The second one, you're going to want to get the extremities above the heart. So if it's a leg or arm, raise it above the heart. Next, the pressure points. You got some major pressure points throughout your body. On your inner thigh, the arm here, you have some, and then on your inner thighs, and you also have some on your neck. One side, please. 2 sides. If you have an ex-wife or an ex-husband that's bothering you, go ahead and perform that. Self-buddy care. And you also have a tourniquet. Once you put a tourniquet on, you can't loosen it. And then, as a last resort, some people may have a quick clot or quick gauze, and what that is going to do is perform. It's going to make the blood basically a super clot, and they're going to have to wash that out and treat it, and they're going to have to cut it out. So that is why that is your last resort. So now that you've evaluated your patient, you determine if they've had internal, external bleeding, and you got their bleeding under control, it's time to see if they have any fractures that you can splint, and how to move them. Some signs and symptoms of fractures is the deformity and the swelling and discoloration. The obvious is you're going to see the bone sticking out. Do not push that back in. You're always going to splint it as you see it. You usually go above and below the joint, try to immobilize it. And you're also going to want to prevent any further damage or pain. So split as you see them in place. Their arm normally raised to their chest. You can use some anatomical splints, which is like when you jam your fingers and you use tape. You tape your fingers together, or you can tape your arm to your chest, or tape it down by your side, or you can tape your legs together to keep them from moving. You can also use some environmental splints. You can use a branch from a tree to keep your arm straight on both sides. Just make sure you use some padding. You can also do that with your forearm. If you break your forearm, use a couple tree branches, keep it in place. You can use your belt, tear your t-shirt. In the movie 127 Days, the guy cuts off his wrist, so he's going to have to use that tourniquet and then split his in place. Basically, for care, you're going to want to prevent movement. You're not going to want to have that splint just moving back. So, try to keep it in place. And once you got everything splinted up, you're going to have to move that person. There's a couple ways. You got 1 and 2 person carries. 1 person carries is kind of like the Forrest Gump you see in the woods. You just throw them over your back. That's the fireman's carry. You have the clothes drag carry, which is over a short distance where you just roll up your collar and drag them. And you also have the kid that falls on the soccer field where you just kind of scoop them up and rush them off. 2 person carries, if you have a stretcher, use that. The person in front normally gives the commands because they can see where you're going. If you don't have a stretcher, you can improvise and either make a forearm basket with them where you lock wrists and forearms, or you can, 1 person grab them by the ankles, 1 by under the arms, and carry them over a short distance. You can also improvise stretcher. Use a couple tree trunks and use your shirt and pants as padding. Use anything that you got, basically transport them out of there. So now that you've learned how to splint a fracture and how to transfer them to a medical facility, hopefully you've saved a life and a limb if possible. So in conclusion, I hope today you've learned some basic life-saving skills. Remember, you always want to check the scene first. You don't want to make yourself become a patient. You always want to make sure the scene is clear of any hazards. You also want to assess the number of patients. You're not going to be able to treat every person. You're only 1 person. The first person you want to treat when you come upon a scene is yourself. Make sure you have your latex gloves, your barrier mask. You don't want to catch any disease out there, so make sure you protect yourself. You're always going to want to treat for shock, first, last, and always. Keep them talking, keep them calm and warm. Once you get them relaxed, perform your ABCs of first aid, your airway, breathing, circulation. Once you determine if that person has internal, external bleeding and you controlled it, do your 5 methods: elevation, pressure points, tourniquet, quick clot, or direct pressure. You want to splint the fracture in place, immobilize it above and below the joints, and ways that 1-person, 2-person carries to the hospital. And hopefully you have saved a life. My name is Ken Howell, and hope you have a nice day.